After 4 years on the job, Shelby County Health Director Dr. Michelle Taylor is moving to Maryland, stepping into a similar role in Baltimore in just over 3 weeks. Taylor's tenure in our Bluff City has been filled with highs and lows and lots of lessons in between. Tonight, she sits for an exit interview of sorts with Kelly Cook.
You think you got a fair shake in this role?
I do.
Dr. Michelle Taylor's stint as director of the Shelby County Health Department started with managing a global pandemic.
We have had 2 pediatric deaths in the community.
And ended with a controversial fight for clean air.
Shelby County Health Department, prove that you are not bought and paid for by XA9.
Her time in office.
Dr. Taylor, I'm asking you a question.
A roller coaster of highs and lows that actually started during her confirmation process.
What do you remember about that day and about that time?
So what I remember most was dealing with my family and their emotions around the vote.
In 2021, an interview panel chose not to recommend the Harvard, Johns Hopkins, and Howard University graduate for the job, scoring her high on being articulate, a native Memphian, and highly credentialed, but called her presentation on how she planned to change the health department weak. Shelby County commissioners pushed back and approved her appointment unanimously.
I'm going to do my level best every single day to prove to you why you made that unanimous vote.
Dr. Taylor says she spent the past 4 years trying to do just that.
So this board was completely empty when I started.
Keeping her plans front and center.
It's a bit busy, but it has morphed over the years.
Goals went from words on a whiteboard to actual accomplishments. Like the next time you head to the emergency room for any reason, your battery of tests will include one for HIV.
Knowing your status, that's how you start to bring the rate down.
The greater Memphis area now second in the nation for new HIV cases. Taylor led the charge for hospitals to change their protocol to automatically test for the disease unless a patient opts out. Regional 1 has already implemented the change. Taylor says other hospitals are expected to come on board soon. Another goal on the board, clinic renovations. Taylor set in motion renovations at 3 Shelby County clinics, plus a new build in Whitehaven.
It makes a huge difference. The public, no matter who they are or what station in life they're in, deserves to walk into a place that is inviting and that they actually want to come to.
But a phrase added to her board in big red letters later in her tenure is something she was not able to achieve: environmental justice, leaving that initiative up to the next director.
If there is an opportunity to create an environmental justice arm that is separate from our environmental health arm, he or she should definitely consider doing that. And this is why they have to be separate, because you want to make sure that it can operate independently and be able to collect some of the data that our regulatory body may not be able to collect, just because there are 2 different bodies. There are a lot of health departments that do not have what we call an EJ section, right? It tends to be something that gets created out of controversy, right?
That's exactly where the Shelby County Health Department finds itself right now, with community concerns over air pollution from XAI's supercomputer in southwest Memphis.
So you're seeing a community that got blindsided and they're angry.
Activists say XAI operated gas-powered turbines to run Elon Musk's Colossus without permits for months. And both the Southern Environmental Law Center and NAACP have threatened lawsuits. Dr. Taylor would not answer direct questions about XAI during our interview because of possible legal action, but says the next health director will need to put environmental concerns at the top of their priority list.
But I would hope that the next director will understand that it is supremely important to listen to the public about what they have to say about their concerns. Take that into deep consideration and find ways to assist the public in making their concerns heard. It is not always easy to do. You will get yelled at. People will call you names. You may even have a security detail a couple of times. You may get walked into the building by a security guard every day. All of those things. But at the end of the day, if the public is able to express their concerns, if the public is able to really feel like that they can access public health at every level, and if the public feels like the Shelby County Health Department is doing their job, then as a director, you've won.
Taylor says she never expected to leave this job. This was a homecoming for the White Station graduate. But she says she had to take into consideration a new county mayor will be elected next year, putting her appointed role as health director at risk.
What are you going to miss the most about being in Memphis, about walking in this building, about going to the next community health fair? What are you going to miss the most about being at home?
I am not going to cry on camera, but the staff here, the dedicated professionals here, they just work so hard every day.
Kelly Cook.
Remarkable leader. Just days after our interview, the Shelby County Health Department approved those gas turbine permits for XAI. On the very same day, Mayor Lee Harris appointed Dr. Bruce Randolph as the interim director of our Shelby County Health Department. He's got a tall task ahead of him. The health department has already lost $2 million in federal funding so far this year, and 13 positions were eliminated. Dr. Taylor's last official day on the job is August 1st. Her first day on the job in Baltimore is August 4th.